Hello again, I'm Tim Spector of the Zoe COVID study, giving you this week's update. And we've seen an increase in cases across the UK again. And this is a bit of a worry given we've only got a few weeks left to go till Christmas. We're looking behind those headlines at what we think the reasons are for that change and what we can do about it to protect as much as possible our relatives and those that are more susceptible from COVID over the festive period. And also we'll be looking at Europe to see what lessons we can learn from the big changes that are going on there. But first, let's get down to this week's data. So the total number of cases is around 76,000, which again is always more than the UK confirmed cases as we expect. And about 24,000 of those new cases have been double vaccinated. That's about the same, about nearly a third of all the cases. Now, that's an 18.5% increase in the last week, which is a lot. We don't see that kind of increase very often. And about 1 in 66 people now have COVID. Again, fairly similar to last week, because the prevalences are slower to change than the incidence, which is the new cases. Average deaths are around 924 over the week, slightly down, and certainly fourfold lower than we were seeing last year, which is some bit of comfort. Hospitalizations are running at about 835 a day on average over the last week. Still not much big change week on week, and this is still leading to about over 900 people on ventilators in the UK, slightly down but still pretty high. And that proportion in hospital is still worryingly high, given that hospitals are full of lots of other non-COVID diseases which have been facing this backlog that most people know about. Now let's look at the age groups, and you can see on this graph here that the blue line is the under 19s, and we can see those big changes that peaked and then dropped, which in retrospect look like the half-term effect, and then obviously takes a while before those infections start creeping up again, but they certainly have. And nearly back at those levels we saw in October, and small increases in the 30 to 55-year-olds showing an increase, which is sort of what we expect from the parents, sort of average age of the parents in those kids. And if you look further down the graph, you see the red line and the purple line, they're going down and certainly not going up, and that's so far good news, and probably reflects the fact that those groups are more highly protected through vaccines than the younger groups, and probably taking less risks. So this is a clear message, really, that for those of you who haven't had your booster, to do so now to get the maximum protection. And we've also identified some risk factors in those who are being infected after just having had the 2 doses in the 60 plus age group that we do worry about. And it seems to be that the breakthrough rate in those people is much greater in those who are frail, suffering with other diseases which we call comorbidities, such as lung diseases, heart disease, or asthma. And these people particularly need to get those boosters really as soon as they can, particularly given the high risk at the moment. And it does work quickly. So I think it's becoming clear that the only really we can ensure that, say, our grandparents and other elderly relatives are safe during the festive period is to get those third jabs administered, because that's the only thing that's going to work fast enough. The vaccinating children isn't going to be useful, and it's also being extremely slow in this country anyway. It's probably not going to help us until the spring. And I think this is the most important message really for surviving Christmas. Now, it's still likely that thousands of people will still be in hospital Christmas Day because of the high rates, but at least we can make sure it doesn't get any worse. So the final message is to get that Black Friday deal. There's a 95% off your chance of getting an infection with any booster over that period of time. So you can take up my offer as soon as you can. Now let's have a close look at the regions where we can see that the worst hit area is Wales. The best performing areas are Scotland and London, but there's actually not a huge difference between them that we saw in previous waves. So everyone is getting very similar trends this time round. It's a different sort of picture we saw a few months ago. So let's look at symptoms now and these cold-like illnesses that many people are complaining about. And if you look at the graph, we can see that cases, as we predicted, of colds, which are in the yellow, have ticked up in the last week or so. And this is probably being driven again by children. And there's about a 1 in 3 chance of a child having COVID if they present with respiratory symptoms at the moment. So need to be really suspicious of anything that looks like cold or flu in kids at the moment with these rates so high. And since we know that colds and COVID are going together and that they cause problems, and the kids generally in all countries seem to be driving this, there might be an argument for looking again at school terms and the attempts to break up infections with these so-called fire breaks, which didn't work at all for adults in previous waves, but it might be something to pilot in children. And we may also want to think about the timing of school holidays, which looks like it could be fairly crucial in reducing severe infections in older people weeks later. The other thing we need to just remind everyone is to be very familiar with the symptoms that are very similar. And you can see this graphic here just reminds you what they are. Can't really tell the difference between COVID and a cold at the moment, but do share these, and we'll be having a bigger session to talk about why the people that say COVID is just like a bad cold have got it completely wrong, and we'll be going in detail about, so look out for that video soon. Now let's have a look and see how other countries are faring at the moment. Now you will have heard some of these localized riots that have been going on in a number of countries in Europe as restrictions that were relaxed a few weeks ago have been brought back with a vengeance. And this has included places like Belgium and the Netherlands, where media have shown lots of scenes of disquiet. Austria has actually gone from preventing unvaccinated people leaving their houses to actually mandating vaccines by law and imposing fines or prison sentences on that. Hasn't fully passed the legislature, and it's probably unlikely to do so because it's pretty impossible to get through even if you believed in it. But it does give you an idea of the reaction of Europe to what's going on there. And if we look at the graph here, we can see that while the cases are still high in the UK, and that's the one here in green, we're also seeing Austria, Belgium, Netherlands, Ireland, Denmark all going way past us with around double the rates of new cases. But of course, we've had those sort of rates for months where they've had nothing. So we can expect to see a sharp increase and then a fall in those cases because they're now bringing in restrictions, whereas we just sort of let it rip. So it'll be interesting to see these differences. In France, say that France, which is somewhere in the middle, it looks like it's heading upwards at the moment, but it's still lower than the UK and has done very well for the last few months. They say their pass sanitaire, which is their equivalent of this sort of vaccine passport, has increased vaccination rates considerably. But despite those high vaccination rates, they are showing at least an increase at the moment that's a little bit worrying. The politicians in this country have been perhaps over boasting about how brilliant our booster program is. But if you look at the graph of hospital admissions here, which is really the important thing, I don't think it's anything really too much to be cocky about, because we're still pretty high up on this league table of hospital admissions. And of course, we've had this high number of hospital admissions and deaths for months now, whereas these other countries, apart from the US, which is even a worse state than we are, have been much lower. So they're now seeing these temporary increases at or above our levels, and they're panicking, whereas we're definitely not, and we're saying we're absolutely fine. We've got the best vaccine program in the world, nothing to worry about. I don't think it's quite as clear cut as that. The German health minister stated there's only 3 states you're going to be in Germany. That's you're either going to be jabbed, you're going to die, or you're going to recover from COVID. That sounds a little bit extreme, but I think it does make the point that vaccines absolutely reduce the spread of infection and hospital admissions. And for many countries, vaccines are the way out, and that's why they're mandating them with strict legislation. The ex-vaccine minister in the UK, Nadim Sadawi, said that we'd be the first country to beat COVID pandemic with jabs, based on the idea we front-loaded immunity with lots of infections since Freedom Day. But I think this is very optimistic and a little bit cocky, and really just seeing where we are and retrospectively saying it was all planned this way. And despite this, people are now also saying we're in a great position. We may be reaching herd immunity in this country, but we've been wrong so many times on herd immunity, and really there's so many assumptions in a lot of these models that I'm going to be a bit skeptical on that, and I'll believe it when I see it. But I think all this talk from our government of how brilliant we are and how our vaccine program's been fantastic is nothing to be smug about, because if we look at our death rates, and you can see in this graph here that we are one of the top countries in the world really for this cumulative death rate, and only a few countries have done worse than us. And it's not an impressive graph to look at. So all needs to be taken with a pinch of salt. And the UK is ahead of the rest of Europe in terms of boosters, but it's behind Israel. And if you look at the difference in boosters, you can see that we have only got about half the rate of booster injections to Israel, and so a long way to go. Now let's talk in a bit more detail about boosters. So for boosters, or the third dose as it should be called, protection definitely seems to be more effective for 2 doses. Our own data from the Zoe app, which you've been collecting for us, has shown that about 2,200 people have so far reported a positive PCR test after having that 3rd jab. Sounds a lot, but that's out of about 387,000. So the rate is only about 0.6%, which is pretty low, and that compares, just to put it in comparison, with around 1.1% that we saw who had 2 jabs only. Now, these are raw data. We haven't adjusted them fully, but it just gives you a flavour that third jab really is really vital and important. So we continue to keep an eye on those figures in case they change. Also important to know that if you're reluctant to get that third jab for some reason, because you maybe had one of those unlucky people who had a bad reaction to it, the side effect profile is better than for the second dose. So some people got a worse effect for the second one. In general, that seems to be less when you have the third one. We don't know why, but that's what your data is telling us. Now, we're currently looking into the efficiency of mixing and matching these different vaccines, whether you had AstraZeneca first or Pfizer first, and data that's preliminary but looking very good from Imperial College show that it doesn't seem to matter which one you get. It brings it up to the level of the Pfizer jab, which initially at least showed greater protection levels. So I think it's a good idea to get that extra boost if you had the AstraZeneca from that Pfizer one in particular. So we'll, again, keep you posted on any new data we get. So to sum up, I think the UK, by avoiding lockdowns and extra restrictions and its over-optimistic messages of complacency that we're over the worst and that Europe's now facing much worse problems, I think is helpful to avoid riots, but actually is going to cause more infections. So whether this is the right battle to have been facing and to say we've won, I think is tough. Our hospitals are still completely full, and people are having their treatments cancelled for their cancers and heart disease, and it's hard to see that this can be labelled as a great success as we go into the most difficult part of the year. Now, although we're doing better at the moment than a few European countries, although others are still doing better than us, our hospital admission rates are really far too high, so we can't get complacent. And although we started the vaccine program before all the other countries, which meant that our booster program was pretty much the first in Western Europe, it was rather half-hearted and hasn't really picked up the pace that it needs to get to the rates of Israel, and it's still too slow. But there is time to do something, despite the fact that cases are on the rise again, and it's too late for Plan B. So I think we have to hope that these changes in the kids isn't going to spill over to the over 50s. I don't believe the government has the stomach for any restrictions over Christmas because it wants to stay popular. And I think our best bet through the festive season are 2 key policies. The first is to get as many people with their third vaccine shot as possible, to give protection to those elderly and vulnerable people. Gives you 95% protection, much more than you get with 2 shots. And that will have an effect within a week of getting that shot. All the other measures are much more longer term. The other point that everyone can do is to realize that if you do get cold-like symptoms, you've got a 1 in 4 chance of it being COVID. Do self-isolate until you know what it is. Take a lateral flow test. Don't take any chances because you're very likely to spread it to other relatives. So with that bit of festive cheer, I will sign off and thank you for watching. Do subscribe, do like, and look out for all these other videos that are going on in more detail, and stay safe and keep logging.